At the Kent District Library, we exist to further all people through kindness, empathy, and love. I just want to take a moment and thank the World Affairs Council for partnering with us, and I want to thank our wonderful speaker this evening, Fatma, Tanis, for being here. I'm very excited to hear what you have to say. We have an exciting fall at the Kent District Library. We strive to offer programming that engages our communities and provides opportunities to grow and connect. Here are a few of the varied offerings that we have happening at Katie over the next month. We have a Write Michigan Story contest that's happening right now, and we're accepting entries through mid-November. We have Anishinaabe Stories and Teachings, Fall Foraging, Coffee Roasting, and many craft programs. Basically something for everyone. So check out kdl.org/events for more information. Many of our programs result from our valued partnerships that we have formed in the community. We are thrilled again to collaborate with the World Affairs Council in this series on global health. We are pleased also to introduce Fatma Tanis, NPR correspondent covering global health and development. Tanis reports on U.S. foreign aid policy, the global humanitarian aid sector, as well as poverty and hunger, among other global health issues. She's covered some of the biggest humanitarian crises in the world, from Yemen, Chad, Gaza, and Ukraine. Her reporting is often focused on the most vulnerable populations around the world and how they are impacted by the policies of governments. For over a decade, Tanis has reported on major events from all around the world, with a focus on the Middle East, including social change in Saudi Arabia in 2018 and onward, the aftermath of the death of Mahsa Amini in police custody in Iran in 2023, Turkey's geopolitical strategy vis-a-vis Russia in the West, the plight of Syrian refugees in Turkey, and the war between Israel and Hamas. Tanis speaks Turkish, Arabic, and can survive in Persian. After Fatma's presentation this evening, there will be ample time for questions. Please exhibit civility to our guests and hospitality to others by asking respectful, succinct questions. Her presentation tonight is titled Covering Global Health, A Journalist's Perspective. Let's welcome Fatma Tanis to the stage. Thank you.
Thank you very much. Can everyone hear me okay? Yes? Great. Thank you so much for having me here. It's truly an honor, and I'm just so excited to be among people who are curious about the world that we're living in. I'm mostly excited to hear what kind of questions you have and what you're curious about. But I will, be telling you a little bit about sort of my perspective covering global health and U.S. foreign aid, especially since January 2025, when we saw this major shift in U.S. policy. And I will kind of just give you guys a little disclaimer because, I have been a journalist for over a decade, but I'm new to the subject of foreign assistance. I had been mostly covering international news, mainly in the Middle East. And about a year ago, I accepted this new job within NPR to cover global health and development. And, everything was going easy, I would say, as much as it can. And when January came, suddenly there was this huge shift in U.S. approach to foreign assistance, something that has been a very sort of bipartisan, issue, no sort of major changes in that area until now. And so, in the next 20 minutes or so, I kind of wanted to explore what has changed in foreign assistance, why the U.S. does foreign assistance, and kind of share with you mainly stories from on the ground, from people I have met who were recipients of U.S. foreign aid, and how the changes in U.S. policy has impacted their lives now. So when the Trump administration took office in January, they had the goal of restructuring the federal government, and they started with USAID, with foreign assistance. The understanding was that it's something that most Americans are not familiar with. It doesn't touch our daily lives. It's something that impacts other people around the world more so, even though it does have elements that do, involve Americans, when it comes to things like trying to prevent diseases that could reach America, like, the 2014 Ebola outbreak. The U.S. was very much involved with maintaining that disease so that it didn't reach America's shores. Other aspects of it are, for example, America produces a lot of stuff, like, for example, a lot of the wheat that we produce, a lot of the there are these nutritional supplements that America produces that, are bought by the U.S. government to be distributed overseas to people who are dealing with malnutrition, for example. So it is something that is tied in, but again, it's not something that we are, as Americans, are dealing with on a day-to-day basis. Now, setting that sort of aside, I'm sure you've kind of seen a lot of headlines about what has happened since this major policy change around the world, especially when it came to responses to diseases. For example, HIV/AIDS clinics shutting down, or mosquito bed tents to prevent malaria not being available for distribution. When the Trump administration froze U.S. foreign aid funds, it had a huge impact in ways that even we who were covering the day-to-day struggled to quite capture. And to this day, I will say it's something that we haven't really been able to dig into. We're getting bits and pieces as much as we can. But it's been so intricate, and I want to share an example with you guys. So I was in Uganda just a few weeks ago, in late August, September, and the goal of my reporting, by then it's been 8 months. We've been covering, sort of the impact in global health for 8 months. And I was thinking about looking into a little bit of that in Uganda, but I was thinking about looking into other things as well. I was wondering what else is happening. We've been so focused on this foreign aid issue. There has to be other stories to tell. And what took me by surprise was that the U.S. cuts were just everywhere. They were kind of like hitting us in the face in a way that I was not expecting. And in a way that, it touched every single part of our story, the stories that we were reporting. And a couple of examples I will give you guys is, so we traveled all across Uganda, literally the north, the west, and then the east. And we were in such remote areas where there were basically no roads. And so we're driving on these like super, shaky off-road areas for hours and hours. And I mean, the landscape was just beautiful. It was lush and green. But the people had really experienced this shock when suddenly a lot of the services they relied on were cut in January. And it was kind of like all over the place. I mean, we went to refugee areas. So Uganda, I'll give you just a little bit of background. Uganda is a country in Africa that is hosting the most refugees right now, because it's surrounded by a lot of conflicts. South Sudan has been in crisis for many years. Sudan is a more recent really large crisis that has happened. And then on the other end, it's got refugees from the Democratic Republic of the Congo coming in. And so it's hosting about, more than 2 million refugees. It doesn't have a lot of resources. So it's relying a lot on foreign assistance. And, when the funding cuts came in, for example, the WFP, the World Food Program, which provided food assistance to many of the refugees in Uganda, they were promised $65 million from the US government for 2025. All $65 million was cut. So they lost all of their funding. And what that meant was that they suddenly had to stop providing refugee populations with cash aid. The cash was for food. So they would take this cash and, buy a little bit of wheat, some cooking oil, some salt, and it's not a lot of money, but it did help, not only the families, but also the local economies to kind of keep going, because the refugees are buying from the host communities, and then there are all these like little businesses that are able to make money off of it. And suddenly it wasn't just that the refugees had lost that kind of cash that they were relying on. The host communities no longer could find customers to sell products to. So they had become impacted by the cut suddenly. Elsewhere in Uganda, near the border with the DRC, I was hearing from local authorities that they were no longer able to do disease screenings, for example. The DRC is a country where there are a lot of really deadly viruses, outbreaks right now, especially Mpox, Marburg, Ebola, several others. The conflict exacerbates the health crisis. And so Uganda is receiving all of these refugees who sometimes go to other countries from Uganda, and they were no longer able to do disease screenings, for example, at the border. Another interesting thing that I heard was, we were visiting these small little towns, and everywhere we went to, you had to do this like courtesy visit to the person who's in charge, the local official who's in charge. And so we would go and we'd sit with them for an hour and just hear what they had to say. And in this particular sort of area near the border with the Congo, I was hearing people talking about a shortage in ambulances, specifically that they used to have 8 ambulances to serve a population of over 200,000 people before the foreign aid cuts, and now they only had 3 to 4 ambulances. And so what was happening was that if you needed an ambulance, the clinic or the hospital would basically wait for someone else to also need an ambulance to pick you up, because they didn't want to send people, send cars just to get one patient. And it had created this problem because this was also an area where, an average of 60 births were happening. Some of them had to be, transferred to bigger hospitals if they were, more complicated cases, etc. And this detail was quite interesting, and I wanted to run it down because, you always have to confirm what you're hearing. I wanted to understand more, were these ambulances actually U.S. funded, for example, which non-governmental organization was funding, was implementing, was running these ambulances. And what I found out was actually more interesting, because it turns out it wasn't a shortage of ambulances that was the problem. The 8 ambulances were still there. It was that the US was funding the fuel and the drivers for those ambulances. And when that funding got cut, the NGO, the sort of, nonprofit organization, in this case, Medical Teams International, which is a US-based organization that provides medical care around the world, they lost that stream of funding. And because the funding works in such specific, it's such specific ways, you can't just kind of like move money around, because, everything is being specifically funded from wherever it's coming from, whether it's philanthropists, whether it's from the government, whether it's from other organizations. And so they didn't have money for fuel. And so they were only running up to 3 to 4 ambulances a day. They only had that many drivers. And the other 4 were just sort of sitting around. And it was really kind of shocking to hear this, because even though I had been reporting on the impact for so long, it never had occurred to me that like the smallest detail of how to, start a car. That funding was coming sort of from the United States, and it had been cut. So the impact is vast, and I have to say, the dust has still not settled, because, while there have been, mass layoffs, for example, overseas in people working for these NGOs, locals, we've seen local NGOs shut down. All of these things have happened. The long-term impact of this we have not seen, and we won't know for a while, because there's still some money in the system that is kind of running, helping it run, in very sort of restricted form, but it's still kind of there. And so that's something to keep in mind, because we're going to be, if things don't quite change, we're going to be seeing, major impact. We've already been reporting on, people who have died as a result of not being able to access healthcare. We at NPR, we reported on the case of a 6-year-old boy in Nigeria who had a chronic disease, and it spiked, and his mother was not able to take him to the nearest health clinic because it had shut down, because it was funded by USAID, which has been dismantled. The kind of putting that aside, the thing that I also wanted to talk to you guys, because we've heard so much about the health impacts, including like I said, the clinics shutting down. I'm sure you've seen the headlines about some of the deaths that have happened as a result of funding shortages, et cetera. But there's kind of this huge pocket of foreign assistance that is not really being talked about as much, because it's not as sort of emergency, for example, as health might be, in terms of people dying because they can't access a hospital. But the other part of foreign assistance is called development. And it's this jargony word which essentially means, promoting self-reliance in the recipient countries. So while a huge chunk of US assistance goes towards health and humanitarian, so the immediate sort of response to a crisis or an immediate, an outbreak that could happen, or disease, conflict, etc. There's a huge bucket that is geared towards how do you support a country so that it can take care of itself when war happens, when disease happens. It's the part of foreign assistance that's meant to, create sustainability so that countries don't have to rely on American assistance. That part has completely disappeared. And I say completely disappeared because in recent weeks, the Trump administration has come out with their strategy for global health, and some of you may have seen that already. We're still kind of waiting to see some more details about how exactly the administration plans to roll it out. But essentially, they're saying, okay, we're not going to abandon foreign assistance completely. We recognize that, you do need to figure out how to address health issues like HIV, like tuberculosis, like malaria, and many others. Their plan only focuses on health, and their idea is to, work directly with recipient governments instead of nonprofits. So the money, instead of going to a nonprofit charity to implement work, for example, to run ambulances, it would go to the Ministry of Health of a recipient organization, and the government would be doing that work. Now, there's a lot There's a lot of complications that need to be sorted out in that plan because, does, for example, the government of Rwanda have, the technical ability to provide those kinds of health services that the U.S. is paying them to provide, et cetera. So those are things that need to be worked out, and, the administration says they will be using the next several months to figure all of those details out, and they're implementing this new plan in April 2026. Going back to what's missing, development. Development means building roads, schools, electricity, figuring out the supply chain, technical stuff that allows a hospital to keep getting its medicine or to manage its stockpiles, etc. All of that is development work. Another huge part of it is work that aims to lift people out of poverty. So that stuff is not quite figured out into the administration's plan for foreign assistance, and I want to talk about that a little bit because in my sort of recent trips to Uganda and before then Chad, because I was really sort of faced with what it means to be the recipient of this kind of assistance and then what it means to not have it. And one example I will give you for someone who has benefited from this type of help is this 35-year-old woman. Her name's Merida. I met her in sort of on this, mountain in Uganda near the Kenyan border where they grow Arabica coffee trees. And she grew up in this super remote area. And her parents were coffee farmers, her grandparents were coffee farmers. Her parents had the vision to send her to school. So she always knew she wanted to go to college, and then she wanted to come back and help her people. Because one thing she noticed early on was that the women in her community were being abused by their husbands. There was a lot of cases of domestic violence, specifically around harvest time, because what would happen was the women would work in the farms. They would, pick the coffee cherries, go through the process of separating the fruit from the bean, and then sort of drying the coffee, etc. And then when it came time to sell that coffee, the man would swoop in, take the sort of sack of bean, several kilograms, whatever the woman had kind of worked hard to yield, and they would sell it directly to the buyer, and they would take the money. And in some cases, they would, go off and spend it. In other cases, they had total control over it, and the women in the family was unable to, buy her basic needs, unable to ask, for school fees to send her kids to school. This is something I heard a lot. And, when she tried, they would get into these fights and it would lead to domestic violence. And so this is something that Merida saw a lot in her community, and she grew up with the sort of awareness that a woman needed, financial independence in order to be able to get out of a situation like that, where you're stuck and you're being abused by your spouse. And so this woman, she graduates from university, and she wants to go back to her community to help. She's thinking about being a buyer. She wants to buy from the women directly instead of the men. But she doesn't know a lot about the coffee business. She doesn't have money of her own. She herself had an unfortunate incident with her own, personal life with her own spouse. And she hears of this training program that was funded by the Netherlands. In this case, it wasn't funded by the US, but the US does fund trainings like this. So if you're an aspiring entrepreneur, for example, and you're like, I have this business that I want to get into, I don't know anything about it, the US provides funding for these trainings that teach you about financial literacy, how to use a bank, how to save money, in her case, all of that, but also she didn't know about coffee. She knew the basics of it, but she didn't know how to, yield high quality coffee that can make the most money that it can, because Arabica coffee is highly sought after. And so she was making mistakes, like, for example, storing the coffee where the chickens or other livestock was, and obviously that messes with the coffee's quality. So she goes through this training program, and in just 3 months, her life changed. She learned so much. She went back to her village. She taught all of the women what she learned. She taught them how to save. These are women who don't know how to read. They have not been able to go to school, but she taught them how to save money, how to create mini banks by pulling their savings together and sort of borrowing from that. These are all things that she learned from other NGOs, just from being surrounded by that world in that training program. And now she's built this company. She employs over 1,000 women farmers from her village. Many of them have, been able to take control of their own lives because of that, because now they have money that they can touch. They can go to the store, they can buy soap, they can pay for their kids to go to school. And it's interesting because, in a way, this is kind of like the whole point of foreign assistance, right? You give someone just a little bit of help, just a little bit of support, and they're able to kind of go do their own thing. Everything else that she's managed aside from that training has been completely, her own initiative, her own success, her own vision. And she's not the only one. There are so many people, not just in Uganda, but in other parts of Africa and other parts of Asia who've kind of been recipients of this kind of support, and have kind of just been able to achieve, their own potential in a way. On the other hand, what happens in an area where there's, a humanitarian desert, so to speak, is just it's so stark. And an example that I'll give is, I was in Chad a year ago. This was before the Trump administration. This was before the foreign aid cuts. So this was when the United States was giving, $40 billion a year to foreign assistance. But this particular pocket of Chad was not really receiving a lot of international attention, was not really receiving a lot of foreign assistance, not just from the US, but overall from anyone. And, as you guys know, the Sudanese civil war has been, has led to one of the world's largest, actually the world's largest humanitarian crisis right now. Millions of people displaced, all sorts of horrific violence going on. And we couldn't get into Sudan because they wouldn't allow us in as journalists. So I traveled to Chad. I was just kind of on the border with Sudan, so I could, meet refugees right as they were coming into Chad and be able to get, their fresh stories. And Chad is a very sort of difficult, I would say, or a more challenging place to sort of do any kind of like humanitarian or development work, because there's just so much less available. Like, for example, in Uganda, the roads were rough, but they were there. In Chad, there were no roads in that part. And so, if you wanted to move around, you had to like have a helicopter or, be able to fly, and the UN does have flights, but they're not that frequent, and they're usually small airplanes or small helicopters. And so this is kind of like the area. There's a huge need, so many people, very few international organizations operating. It's difficult to get to, but then also it's not really at the forefront of people's attention. So there's no funding really going to that area. I will never forget this one girl I met. Her name was Halima. Her name is Halima. She was 16 when I met her. She's now 17 years old. She fled Sudan on her own because her family had been killed. She had one surviving sister who, they got separated in the chaos. And she kind of, it took her 3 months to get to the Chadian border. It's a very dangerous journey because of just so many, violent things that happen on the road, robberies, rapes, all kinds of things. She made it to Chad, and she had been there for a year when I met her, so she was not a recent arrival. Now, this girl was the only person in her family who knew how to read or write. She was the only one who had an education, and she's just 16. But that little bit of education, in a way, she knew just how bad her situation was because she could see where her future was leading. In the camp that she ended up at alone, there were barely any services, let alone food or health, but certainly no schools, no education. The country she was in, Chad, doesn't have resources like that. Its own population is struggling with poverty. And so she was really in a destitute situation. And I've really never met someone who was so desperate to continue her education because she knew that was her only way out. She was kind of, instead she was just doing daily labor, helping the woman who had allowed her to have just a little small bed in the hut that they were staying in. And I think in this case, she needed someone to be able to give her a little bit. She needed a way to be able to continue her education. She said, if I can just finish, I can find my own way. If I can just get a degree, I know how to be a teacher. I know how to be a doctor. I have it in me. I can keep going. But what her future instead looked like, and she knew it, was that most likely she was going to be, married off to somebody. And that was it. There was no way out from the camp that she was living in. And so in this case, even if that camp did have humanitarian services like food, like medicine, she would still be stuck because there's no education, right? There's no job training. There's no job opportunity. There's still no way out. And so development assistance is that way out for a lot of people. That's the one thing that, we're kind of seeing missing from the administration's plan. And that's another thing that also has a much longer term impact than perhaps, a humanitarian response, for example, because, while health and humanitarian assistance, is about saving today's lives, development is about saving tomorrow's lives. And so with that, I'm curious to hear what kind of questions that you guys have.
Let's give Fatma We've got a microphone here. I can also pass around a mic as well. And again, if you would like to write a question down and hand it to me, or I thought that it's just fine too. Just to get us started, I really think it's interesting when we start to think about the question of development as opposed to immediate assistance, humanitarian or medicine or things like that. When we think about well-being and health as tied to very contextual things like poverty, access to resources and opportunities. So I'm really glad that you shared that a little bit and gave that context for us. Do you see any potential opportunities in this next couple months or years to find a way to create those opportunities for the people that you're meeting?
Yeah, it's a good question. I mean, on the one hand, I will say that because the U.S. has been a leader in this sort of in this sector for the world, and it has actually accomplished so much that's evidence-based, data-driven. There are actually a lot of, I mean, I won't say a lot, but like philanthropists who are definitely interested in, picking up where USAID has left off. Now, the thing is that they can't quite cover, nowhere near as much as what the US government was able to in that sense. But I think the other thing is that, what we've seen from the administration is, I think, an interesting sense that they're not quite abandoning foreign assistance, even though it looked like that for a very long time. And I think there is potential for them to kind of shift back towards that, because if they're focused right now on, for example, solving, let's say, malaria, right? Or HIV/AIDS or the health issues, like that stuff goes hand in hand with development. So, for example, how are you going to deliver drugs to an area where there are no roads? So these kinds of things prompt questions and that the administration will likely have to answer.
Yeah.
So I was interested in what you said about the current administration would like to switch the funding mechanism from NGOs to ministries of the governments. So just in general, from your experience, are NGOs a little bit more honest or have less crap that the governments? Will that be an improvement, or will potentially some of the philosophy cite government right now?
It's a really good question because it's so the grievance with NGOs, and the Trump administration has called them Beltway bandits, is that there are a lot of overhead costs, right? So if you're paying a charity to do work in, Chad, for example, sometimes you end up having to pay for them to get there, right? Get their personnel there. Oftentimes they bring people from outside. They might have to rent facilities. They might have to rent cars. So there's a lot of overhead costs that comes with that. And, the administration wants to do away with all of that. And they want to work directly with governments. The issue that they may run into with governments, and they have run into in the past, so, when the US was doing foreign assistance in the 1980s, the nonprofit sector was not what it is now. And so they were working with governments. They were doing, bilateral agreements with governments. But they ran into issues there because the governments would often, be unable to meet their end of the bargain or to deliver on the program that they had, promised the US that they would. And in a lot of cases, it was because they were simply unable. In some cases, there was corruption. And so the big challenge for the administration is really going to be, how do you, hold the governments accountable in this sense? I think there are arguments to be made that, you know, perhaps NGOs who receive U.S. funding, who were sort of susceptible to audits and had to, you know, go through this rigorous process of being approved, had to show, you know, where that money was being spent, whether it was, you know, wasteful or other. That's a separate question. But, you know, you could see where the money was going. There are people who say it might be harder with a government where, you know, you're not really, they won't need to be as transparent with the administration. So that's going to be a challenge, but, you know, we'll see what kind of deals they make starting next year. Yeah. Thank you.
Thank you. This may be premature, but what other international donors you see as stepping forward to fill the void, to specify the end of major U.S. assistance in this area? And what are the implications of that if the other major donors stepping forward, for instance, the Chinese?
Yeah, that's a really good question. I mean, what we're kind of seeing now is that a lot of donors have followed in the U.S. footsteps. For example, the UK has also, you know, really pulled back on its assistance for different reasons. What they've done is kind of, you know, moved their foreign aid budget into the military budget for Ukraine. But other countries are pulling back. Canada is another one. There are others, though, who are stepping forward more. France is, and several other countries too. The issue is that none of them can come close to what the US was giving. So in that sense, there's no one really to fill that void. And China is stepping up, and their sort of method of doing foreign aid is quite different from the US. So, you know, while the US, for example, would give money to local NGOs so that they could hire locals, for example, who would do the work, or they would train locals to do the work, the Chinese just sort of, you know, send their people to build up a clinic, and it's run by, you know, Chinese medical workers. They don't do any of that kind of, you know, training, local, you know, health workers or local NGOs or et cetera. They kind of do their own thing. It's a little maybe early to see kind of how much ground the US has ceded to China on this issue, because, you know, China doesn't have the long history with foreign aid that the US does, in terms of how also, you know, tied in with the local public, with the local governments that the US foreign aid was. And so, you know, we're gonna have to wait to see, but that's definitely a huge concern, not only for just global health experts, but also for the Trump administration. They are very much aware of this, and it's a goal of them for them to counter China's influence in this space. How they're gonna do that, we're still waiting to see. Thank you for your question.
Maybe just as a little follow-up to this, when we think about the regions that are the recipients of aid, maybe you could give an overview to our audience of what countries or continents have been maybe the longest recipients or have the greatest aid historically, and how that may or may not be changing in the future.
Yeah, absolutely. So, you know, low-income countries are mainly the sort of largest recipients of U.S. foreign assistance, and Africa specifically, it has been a huge focal point for just kind of global health and development work, not just by the U.S. but by others as well. And, you know, part of that is because the need is so strong, and governments, African governments, are really sort of struggling to respond to their people's needs in that aspect. We have seen some countries sort of, wean themselves off of aid. The best success story is South Korea, which used to be, a recipient of foreign aid, but then, the tech boom happened, and now they're a donor. But obviously that's a very sort of specific example. India is another country, though, where, it was, a huge focus of global health work, and now the government is largely able to take care of those issues. But yeah, that's not the case for African countries.
Thanks for being with us. Is the United Nations, doesn't tend to have great reputation, like it's arguing and not getting anything done, but we had David Beasley here, who used to run the UN World Food Program, very inspiring, in a tremendous organization. Is that still operating? Is the UN affected in any of this at all? Are they filling some of these voids and able to pull together coalitions to be helpful?
Yeah, that's a good question, because the UN is operating. It is struggling because it also received a lot of funding from the U.S. and the U.S. the current administration does have grievances with the UN that are separate from its grievances on foreign aid. And it has specific grievances with different UN agencies. So the World Health Organization, for example, is a whole thing. It has other issues with the United Nations as a whole. But I would say when you go to these countries, you do see the UN everywhere. It's quite a presence, definitely. They are providing, in a lot of ways, many of the most critical sort of needs when it comes to, humanitarian or medical. UNICEF is still doing sort of a lot of the work when it comes to, children's education and those kinds of issues. I think the UN does have, the ability to rely on other donors as well. Again, nobody can give as much as the US did, but they do kind of have that network. They do have that reputation, and they will survive. But again, I think what we'll see is that their responses will be, and we're seeing that in Sudan right now, for example. Their responses there have been, much sort of slower or smaller than they were for other, more better funded responses. Yeah.
We maybe have time for one last question. Anybody want to take a step? Well, I'll ask it. So one of our wonderful, you have a question.
You.
Okay. Well, one of our wonderful colleagues at KBL, who's not here tonight, always asks, well, what's the takeaway? When an audience member walks out the door from a program like this, what are they learning? What are they going to act on? And so if you could give any sort of advice or perspective to the folks here on what you would argue is the most fundamental thing they can do as American citizens to help positively impact global health, what would that be?
That's a good question. I've been kind of asking myself as I'm doing this sort of reporting, what is the point of foreign aid? Because you hear a lot of arguments sort of floating about, and one of them has been like, why don't we take care of our own problems here in this country first, right? Why should Americans give any money? And while I don't have sort of an answer specifically, because I think everybody can make their own sort of conclusion, based on what you're reading and what you're sort of learning. But I will say something that I heard as I was doing this reporting has kind of stuck with me. A couple of things that I've heard. So when I was in Uganda, I was asking, people if their view of America had changed because of these cuts, and there were some really interesting responses because people weren't angry. Sure, they were upset, they were disappointed. They had broken dreams in terms of like the people who were expecting particularly like livelihood support and were planning to open a business with that small amount of money that they were going to receive or things like that. They had plans and it kind of all crumbled. And I heard someone say, he was referring to President Trump as Father Trump. And I asked him, why are you calling him father? And he was like, well, he's the provider. And so that was that perspective. That's how he saw America, as a provider. The president was like a father figure. Others had, different reactions. Some said that, the U.S. did benefit from, giving foreign aid because it built, we now trust you. That's what this person said. Ultimately, I asked this question to an economist, Dean Carlin, who has long worked in the development space on poverty alleviation, and he was also the chief economist for USAID. And he was like, America should help because America is strong. And if you're strong, you can help. But if you're weak, you can't help, and you're not expected to help. And so that's just kind of been a little sentence that's been sort of in my head as I cover these stories. I think I keep going back to that and thinking about it.
Thank you for those final words, and let's give Fatma another round of applause. Program archived on our YouTube channel, and it'll take a few days to get up and edited, but just search for Laurel, Michigan there and you will find it. And while you're there, please subscribe. And then, of course, next week we continue our series with Dr. Peter Jones, the Chief Scientific Officer for the Van Andel Institute, and he will be talking about Behind the Breakthroughs, Changing Communities. So that will be here again at the Catholic Library at 6:30 p.m. So we hope to see you there. Thanks so much.